Characteristics of exceptionalities and applying the principles of universal design for learning and differential instruction. So, learning disabilities. Some characteristics. They have an average to above average intelligence. They have academic challenges with reading and math, difficulty with memory, sometimes have high levels of anxiety and depression. It's linked to structural differences in the brain. Ways to apply UDL and differential instruction. Curriculum-based measurement, which monitors students' progress. To make decisions about intellectual strategies to use with these students. Orton-Gilham's approach combines explicit instruction and multisensory methods, and then self-regulated strategy development. Speech and language disorders, some characteristics. The 5 components are phonology, which is sound system, morphology, which is word forms, syntax, which is word order and sentence structure, sematics, which is word and sentence meaning, pragmatics, which is social use of language. It is caused from biological and environmental causes. Ways to apply UDL and differential instruction is to use curriculum-based assessment and decrease written instruction, so using visual or verbal instruction rather than so much written. Emotional or behavioral disorders, some characteristics: anxiety disorder, mood disorder, oppositional defiant disorder, conduct disorder, schizophrenia, normal intelligence, emotional, behavioral, and academic challenges. That is also caused from biological and environmental causes. Some ways to apply UDL and differential instruction for emotional or behavioral disorders is to mindful education programs. So to teach mindfulness in students, the W Incredible Years program, it's for teachers, parents, and students. It supports the child to make positive gains in their emotional, social, and academic well-being. ADHD, or Attention Deficit Hyperactive Disorder. Some characteristics. Challenges with executive functioning, which is the working memory, goal-directed attention, persistence, inhibitions, and problem solving. Challenges with academic achievement, challenges with behavioral, emotional, and social functioning. It's caused by a combination of genetics, structural brain differences, and environmental causes. Ways to apply UDL and differential instruction are the HOPS program, which is homework, organization, and planning skills. So working with those students on those skills will help ADHD students as well as any other student in the classroom. Intellectual disabilities. Some characteristics: limitation in intelligence. This could be short-term or long-term or working memory. Limitations in adaptive behavior, which is conceptual, social, or practical skills. These, the causes are biological and environmental causes again. Ways to apply UDL and differential instruction. Embedded instruction and the self-determined learning model of instruction. So teaching self-directed problem solving, goal setting, evaluating their goals and modifying their goals. Autism. Some characteristics for autism are social communication impairments. They have to have all 3 of these impairments and 2 of the restrictive repetitive behaviors and interests. So the 3 in social are social, emotional, reciprocity, and then nonverbal communication and maintaining relationships. So they have to have all 3 of those, and then 2 of either repetitive speech, fixation on objects, excessive or limited reaction to sensory input, or reliance on routines. A lot of times they have aggressive behavior. A lot of autistic students have savant syndrome, which is where they have exceptional talents in some area. The causes are biomedical and environmental. Those can both be causes. Ways to apply UDL and differential instruction. The pyramid model, which is improving social and emotional learning for young children, and also self-directed learning. Okay, multiple disabilities. And characteristics of multiple disabilities is significant impairment in intellectual functioning and communication difficulties. The causes are biomedical, genetic, chromosomal, environmental. It can be any of those. Applying UDL and differential instruction for a student with multiple disabilities. The person-centered planning, which identifies goals, values, and visions with the student and the parents. Some may need assistive technology. Many students with multiple disabilities will need communication devices. Traumatic brain injury, characteristics of that, mild, moderate, or severe. This will determine the extent of the functional changes and recovery recovering depends on the severity of the injury. Coordination problems, physical weakness, fatigue are common effects. Problems associated with memory, planning, problem solving, and abstract reasoning. Emotional, behavioral, and social changes. These are caused by automobile accidents, assaults, and or shaken baby syndrome. Ways to apply UDL and differential instruction. The person-centered planning, so working with identifying goals, values, and visions for the student and with the parent, and then also assistive technology. Physical disabilities and other health impairment. Cerebral palsy and spina bifida are physical disabilities, and then some other health impairments are epilepsy and asthma. Ways to apply UDL and differential instruction for these students will be cooperative learning strategies, which is having small groups of students focus on a common learning task, accommodations and modifications. So accommodating these students with wheelchair accessibilities, being able for the students to be able to reach any materials that they may need, some modifications for tasks, maybe extending times or deadlines, or possibly taking frequent breaks when they need. Hearing impairment. Delayed language. A lot of times if they have hearing impairments as a baby, like firstborn, then that makes their language a lot more delayed. Students will use some spoken language, some will use sign language, and some will use both. Ways to apply UDL and differential instruction. Students with hearing impairments need repetitive, explicit practice and to be able to connect known to unknown information. And intense early intervention, systematic vocabulary instruction, and phonics-based reading instruction all give those type of practices. Visual impairments. Characteristics of visual impairments are it affects the ability to understand concepts and acquire incidental information. Limitations on ability to get around and interact with people and things in the environment. Some ways to apply UDL and differential instruction. Accommodations. So maybe doing more verbal instructions where they can't see as well, or making things larger for them. Adaptive materials and specialized instruction fit to that student. Gifted and talented characteristics. Twice exceptional. A lot of gifted students are considered twice exceptional, meaning that they are gifted, but they also may have a disability of some sort. They are often highly intellectual. They have high levels of creativity, critical thinking abilities, leadership skills, and emotional and social abilities. Their gifted students can be gifted by biological or environmental causes. Ways to apply UDL and differential instruction. The autonomous learning model, which focuses on self-awareness, development of individual talents, and engaging in individual projects.